Hello, I'm Dr. Lucius Pomerantz. I'm a board-certified orthopedic surgeon and specialist in surgery of the hand. I'm also a black belt in Brazilian Jiu-Jitsu and competed a couple of times in mixed martial arts. I hope to combine my passions into some videos. They cannot cover everything that I would like to discuss, but hopefully you all enjoy. This video can be titled Nerves and What Happens When They Don't Work. This was inspired by the recent Ultimate Fighting Championship number 252 with a bout between Marlon Vera and Sean O'Malley. Now, we know that the Vulcan nerve pinch or other similar pressure point attacks do not quite work as shown on TV. However, what if I told you that you could shut down part of the body with an attack? It all starts with understanding a little bit about nerves. Nerves, analogous to the electrical system of the body. If we think of our brain as the headquarters to our operation that is sending out and collecting information, it is the nerves that are quickly transmitting those signals by electric current. Muscles contract when a signal leaves the brain, goes down the spinal cord, and leaves the central nervous system, going into the peripheral nervous system, which controls those muscles. Our brain senses where our body is and what it is feeling when nerves transmit signals from the periphery, the outside, back to the central nervous system and the brain. So how fast do nerves transmit information? Fast. The fastest nerves in our body can transmit signals up to 270 miles per hour. That's 430 kilometers per hour for non-Americans. The big fast nerves in the legs transmit signals about 100 miles an hour or 160 kilometers an hour. To break this down further, the speed of these nerves is about 40 to 45 meters per second. The longest nerves in our body come from the lower back and go to our toes. We'll call that about a meter. So with the speeds of nerve communication we are talking about, we sense certain things in fractions of a second. You know when you stub your toe and you know it's gonna hurt, but there's a beat or toe before it starts hurting? There's a dreaded moment of anticipation from when we know we stubbed our toe before we have the pain. That is because the nerves that transmit pain actually go a little bit slower than the other nerves. All right, so injuries to nerves. For today, we'll focus on a type of injury called neuropraxia. All of us who have hit our funny bone at the elbow know what this feels like. Burning pain, numbness and tingling down the arm, weakness in the hand. Fortunately, it is temporary. Other nerve injuries, lacerations from chronic disease such as diabetes or chronic mild compression such as seen in carpal tunnel syndrome can happen. When a nerve is stretched or crushed, but not cut, the nerve temporarily loses its ability to transmit its electrical signal effectively. Another example beyond the funny bone, but seen in sports, include stingers or burners, seen in tackling sports such as American football. This happens when the head and neck are jerked toward one side, causing the nerves exiting the neck on the opposite side to be stretched. Often you'll see the athlete coming off the field with their arm hanging down at their side because they're unable to lift it. The nerves that control those muscles are not working. All right, well, now let's talk about UFC 252 and the fight with Sean O'Malley and Marlon Vera. It became apparent that Sugar Sean was having issues with his ankle or foot at one point, rolling over his ankle and foot. But if we go back and look closely, we can see that it all started after a calf kick from Vera. Calf kicks are a common strike in mixed martial arts. By injuring the calf muscle, the athlete loses the function of those muscles and they lose mobility. The kicks are a little safer than traditional Muay Thai thigh kicks. One can stay a little further away from their opponent, and they're slightly less likely to kick their opponent's knee. But I'll save this discussion for the high-level kickboxers. After the calf kick from Vera, O'Malley is clearly bothered. If you look closely, he is not able to elevate his toes or ankle. Then he tries to lunge forward, but his toes do not elevate. They stay on the ground while the rest of his body moves forward, causing his toes and ankle to roll under him. This is because the calf kick from Vera caused a neuropraxic injury to O'Malley's peroneal nerve. The peroneal nerve is a major branch of the biggest nerve that comes from the lower back. It travels in a position that is very close to the skin, just below the head of the fibula. The head of the fibula is the bony prominence that you can feel at the lower part of the outside of your knee. The peroneal nerve travels a little more than 2 centimeters, or an inch, from the head of the fibula as it travels down your leg. The nerve is only about 3 to 4 millimeters in diameter in this area. The nerve's job at this point is to control the muscles that elevate the toes and ankle upwards. It also provides sensation from the top of the foot and ankle. You can see that this is what Sugar Sean is missing. It changes the fight, and Vera goes on to win. There are many other examples of this, most notably in the second fight between Demetrius Johnson and Henry Cejudo. But Cejudo was able to weather the storm and recover from the injury and actually go on to win the fight. So to conclude, nerves, the important structures that transmit information to and from the brain. Without them, we are unable to move or feel. When you injure one, you know it. So while a concussive blow to the brain will shut the whole body down, taking out peripheral nerves will limit function to a particular body part. Fortunately, for the most part, neuropraxic injuries sustained in sports are temporary, but no nerve injury should be ignored, and they should always be evaluated by a medical professional. So thank you. I look forward to making more of these videos in the future. Again, please let me know how I can improve or what topics you would like to see in the future. This is Dr. M. Lucius Pomerantz. As an orthopedic surgeon, my goal is to help you keep moving.